Hello everyone, I am Dr. Smitha, consultant endocrinologist. Today we are going to talk about PCOD and its complications, long-term complications. So why worry about PCOD? PCOD or polycystic ovarian disease or polycystic ovarian syndrome can be very common. Most studies report that it can be as common as 5 to 10% of the population. That means that any woman, of all the women in the reproductive age, about 5 to 10 out of 100 women can have this diagnosis of PCOD. So the most common complaints that they have with PCOD can be irregular periods, acne, and excess unwanted hair. But also the other main problem for women in the reproductive age is infertility. PCOD is a condition of anovulation where ovaries do not produce the monthly release of the ovum, and this can cause problems with infertility, and it is one of the most common reasons for infertility for women approaching infertility specialists. So besides these symptoms, are there any long-term consequences of PCOD that we need to worry about? Not only the problems of acne, unwanted hair, infertility, and irregular periods, these women are also prone for certain metabolic risks. Most of the women with PCOD have a problem of overweight and obesity, because of which, and also the PCOD per se puts them at a risk of metabolic syndrome. So they are in the category of pre-diabetes. They are also at high risk of developing type 2 diabetes, abnormal cholesterol levels or dyslipidemia. They also have increased cardiovascular risk factors like high blood pressure, and some patients also very rarely can develop endometrial cancer. So the main thing is main treatments of PCOD not only involve us treating these symptoms but also assessing these women for regular risks of these conditions. We do these by not only checking the hormone levels such as serum testosterone, LH, FSH, thyroid tests in these women, but we also check their glucose levels by doing something called a oral glucose tolerance test and the fasting lipid profile to look at their LDL cholesterol or bad cholesterol and HDL cholesterol or good cholesterol. According to the results, then we proceed with treatment for these ladies for diabetes or lipid problems. Sometimes these ladies can also have can have other complications of PCOD, which is a rare complication but can be seen in the overweight or obese PCOD women, called sleep apnea. So sleep apnea is when someone overweight or obese with or without PCOD has problems with their oxygen levels when they sleep at night. So if there is any complaint of excessive tiredness in these women with PCOD, it is better to consult your doctor. So what could be the main treatment for these patients with PCOD with all these possible complications of type 2 diabetes, their cardiovascular risk, their dyslipidemia or abnormal cholesterol levels, and sleep apnea? The main treatment for all these, to prevent all these complications in a PCOD patient, is weight loss. The first and foremost treatment is the weight loss. If we are able to lose at least 5% of the weight, it does help in the overweight and obese PCOD patients. And the advice to the lean PCOD patients, this is another category of PCOD patients that is being seen these days, which is patients with not overweight, is not to gain further weight. So if you are able to lose at least 5% of your weight with a good diet plan, avoiding excessive carbohydrates, avoiding processed food, avoiding sugary drinks, then there is a good chance of reducing your risk of pre-diabetes, diabetes, cardiovascular risk with the PCOD. And it is so if any women with PCOD approaching your doctors, not only talk about the symptoms of PCOD, which are the infertility, irregular periods, acne, and hirsutism, but also talk about the long-term complications and diagnosis and prevention of the long-term complications. Thank you.